Welcome to Easy Anatomy. I am going to talk to you about subclavian artery. Subclavian artery. For this purpose, we need to cover three major things. 1. Origin. 2. Termination. 3. Branches. We need to cover this material. So, for the origin of the artery, the origin is different in right from the left side. So here is the heart. You have ascending aorta, arch of aorta, then descending aorta descending behind the heart. Okay? Ascending aorta, and then the arch of aorta give brachiocephalic artery in the right side, then give left common carotid and the left subclavian in the left side. So this is left subclavian, left common carotid artery. This is the arch. Okay? What is the name of this artery again? This is brachiocephalic artery. Brachiocephalic artery in the right side is going to divide into right common carotid and right subclavian. Okay? This is right subclavian artery. Right common carotid artery, and this one right subclavian artery. Termination of the artery. The artery is going to terminate at the level of the outer border of the first strap. This is the first strap. Here at this point is going to change the name to be axillary artery. Axillary artery. So again, the origin of the artery in the right side from brachiocephalic, right side coming from brachiocephalic artery, left coming from where? The left coming from the arch of aorta. Termination as axillary artery, where at the outer border of first strap. What are branches of this artery? Before I talk about branches, I want to attract your attention to the fact that this artery is divided by this muscle. See this muscle, which is going to be inserted into the first strap. This muscle is called what? Scalenus anterior muscle. Scalenus anterior muscle. So this muscle is called scalenus anterior. Divide the artery into three parts. Dividing the artery into three parts. Okay? The first part medial in the anterior triangle, the second part behind the scalenus anterior, and the third part in the posterior triangle, and pass in front of the apex of lung. So that's why when you study the lung, you will see that the impression of subclavian artery at the front of the apex of lung. So this is the subclavian artery, divided by scalenus anterior into three parts. First part medial, second part behind the muscle, then third part lateral to the muscle in the posterior triangle, located between scalenus anterior and scalenus medius. Branches. So we have branches from the first part, branches from second, and branch from the third part. The most important branch is coming from the first part. So first part sends three branches. One branch descends to the thoracic wall. It's called internal thoracic artery. So this one, internal thoracic or mammary, because it's going to mammary gland artery. The second branch, which is going behind the carotid sheath, it is big branch and ascend through foramina transverse area starting from C6. This is vertebral artery. Vertebral artery. The third branch is very short trunk. Short trunk is called thyrocervical trunk. It's called what? Thyrocervical trunk. This one, thyrocervical trunk. From the name, thyrocervical is going to divide into cervical branches and thyroid branches. This branch, which also ascend behind the carotid sheath and go to thyroid gland, is called inferior thyroid artery. Inferior thyroid artery. Then we have two branches are running anterior to scalenus anterior. One is called suprascapular and the other one is called transverse cervical. And you see this in posterior triangle, transverse cervical artery. So how many branches coming again from the thyrocervical trunk? You have three branches. One branch ascend behind the carotid sheath. When I say carotid sheath, I am pointing here. You see this is common carotid artery, which ascend through carotid sheath, then go to thyroid gland. It's called inferior thyroid. The second branch is going laterally through the posterior triangle, is called transverse cervical. The third branch is going also laterally and then going at the upper border of the scapula, is called the suprascapular. Okay, so now we covered the three branches coming from the first part. The biggest one is vertebral, and the vertebral bone behind, ascend behind carotid sheath, then enter foramina transversalia number 6 until it ascend to the cranial cavity through foramen magnum. Okay, second one, internal thoracic artery, descend lateral to the sternum and supplying the anterior part of the chest wall. Okay, then thyrocervical trunk, as you see, is going to split into three branches: inferior thyroid, transverse cervical, and suprascapular. Second part of the artery, which is hiding here behind scalenus anterior, is going to give a trunk. This trunk is called costocervical trunk. It's called what? Costocervical trunk. So this branch behind the scalenus anterior is called costocervical. And again, from the name, is going to split into costal and cervical. Cervical refer to the neck, costal refer to intercostal space. And this is what happened. This artery is going to give deep branch, is called the deep cervical. Okay, and going to supply the neck, vertebra, spinal cord, and the other one descend down at the posterior part of thoracic wall. We call it superior intercostal. So this costocervical trunk is going to split into two branches. One is called deep cervical. Second is called superior intercostal. The third part of the artery, which is located in the posterior triangle, usually does not give any branch, and if it give a branch, usually this branch we call it dorsal scapular artery. So this artery, you might see it in some of the cadaver and you might not see it in others. So this branch is called dorsal scapular artery. And if it is not there, dorsal scapular, if it is not there, it is replaced by deep branch coming from this one. is a deep branch coming from this one, from the transverse cervical. Sometime we call it again dorsal scapular. Okay, dorsal scapular. Okay, so this is summary for the main branches. So keep in mind the first part is the most important part when it comes to branches. Here, giving 3 branches: vertebral, thyrocervical, and internal thoracic. Second part give costo cervical trunk. Third part give dorsal scapular. Let me just explore more information related to branches of subclavian artery, because at the end of the day I wanted to take you to the distribution of the artery, what exactly part of the body supplied by that artery. Okay, so here is again the artery. Let us explore the branches. We cut scalenus anterior muscle. Let's cut it. So now the artery is clear in front of me. I wanted to understand the distribution. So the first part sends this artery, which is internal thoracic. Internal thoracic is going to split in the thoracic wall into 2 branches. One is called superior epigastric. The other is called musculophrenic. Musculophrenic supply diaphragm, superior epigastric abdominal wall. And you learn about this more when it comes to thoracoabdominal wall. But for now, just remember that this artery descends lateral to the sternum. So here is the sternum, and then start giving what we call them anterior intercostal arteries. Anterior intercostal arteries. Anterior intercostal arteries. Okay, supplying the front of thoracic wall. So if I ask you, distribution of the internal thoracic artery is going to be related to what? Thoracoabdominal wall, including mammary gland. Thoracoabdominal wall, including mammary gland. I'm giving you just general outline. The detail will come when you study the thoracoabdominal wall. So this is the first one, which descends. The second one, which is going up behind the carotid sheath, is the vertebral artery. As I mentioned before, vertebral artery is going through the foramen transversarium number 6, C6, the foramen transversarium number 6, and ascend through the neck until it reaches, this is the cervical part, until it reaches to the posterior arch of atlas. This is what we call it suboccipital part. Then through the foramen magnum, is going to enter to the cranial cavity. So you have 3 parts here in the vertebral artery: the cervical, suboccipital, then cranial. The cervical part ascends through foramen transversaria from number 6 up to number 1, C1, there is C2, C3, 4, 5. Then go at the posterior arch of the atlas, between the skull and the atlas, posterior arch of atlas. This area we call it suboccipital part of the artery. Then through foramen magnum, enter cranial cavity. Enter cranial cavity. Okay? There, you know the rest of the story. It's going to be joined by its fellow from the other side to form what? Basilar artery. To form basilar artery. What I need from you to remember is that this vertebral artery supplying what? Vertebral artery supplying what? Spinal cord. Okay? Occipital lobe of cerebrum, cerebellum, and brainstem. So basically, it is very crucial artery to provide essential blood supply to the posterior part of the brain, okay, including cerebral cortex, cerebellum, and the brainstem, in addition to spinal cord also and vertebrae. Okay, that's why I'm telling you I need to cover distribution of subclavian artery. How subclavian artery is not limited to the upper extremity. Okay. Second part is a third branch, of this artery is called what? Thyrocervical trunk. Thyrocervical trunk. The thyrocervical trunk is going to split into inferior thyroid artery, transverse cervical, and suprascapular. Okay? This is the inferior thyroid. What is the area supplied by inferior thyroid? For sure, it's called inferior thyroid. It means going to thyroid gland. So this artery is not limited to thyroid gland. It is very important to supply neck viscera. When I say neck viscera, including thyroid gland, include esophagus, cervical part of esophagus, include trachea. So it's going to supply neck viscera. In addition, inferior thyroid artery supply parathyroid gland also, and is going to provide another branch is called the ascending cervical. Which provides some branches to spinal cord and the vertebrae. Okay, so this is the importance of inferior thyroid artery. Inferior thyroid artery again ascend behind the carotid sheath, then descend, and next to thyroid gland, here is thyroid gland, is going to be joined by recurrent laryngeal nerve here. Recurrent laryngeal nerve become very close to each other. When it reach to the thyroid gland, okay, become very close to the recurrent laryngeal nerve, which coming from vagus. This is thyroid gland. Okay, that's why if you want to ligate the artery during a surgical operation, during a surgery on thyroid gland, you need to ligate the artery away from the gland to make sure that you are away from recurrent laryngeal nerve, somewhere here. So keep in mind again, inferior thyroid artery supplying neck viscera, including thyroid gland, parathyroid gland, part of the larynx, because it's going to send inferior laryngeal branch. Also, I forgot to tell you that is going to give inferior laryngeal branch to the larynx. Inferior laryngeal branch. Remember, superior laryngeal branch coming from where? From superior thyroid artery. Okay. Cervical part of esophagus and the trachea. Also send ascending cervical. In addition to that, send the muscular branches to sternocleidomastoid. Muscular branches to sternocleidomastoid. So it is very, very, very important artery. Neck viscera, muscle, spinal cord and vertebrae, etc. How about these two branches? the transverse cervical and suprascapular. Those two branches actually are very important in supplying structures in the posterior triangle, in addition to that, to provide collateral circulation with the axillary artery. So this is the subclavian. If you remember, we said subclavian at the outer border of first rib become what? Become axillary. So here is the axillary artery, which go to the upper extremity, upper limb. What happened around the scapula? Let us imagine that this is the scapula. You will see that branches coming from thyrocervical trunk, transverse cervical artery sending a branch descend at the medial border of the scapula, and suprascapular artery. The suprascapular artery is going to the upper border of the scapula, like that, and anastomosing together around the scapula. Axillary artery send another branch is called circumflex scapular artery, which is going to anastomose with them. Okay, and you can imagine now the importance of this anastomosis. Let us say that there is obstruction here in this area, subclavian artery. So if you close this area, there is thrombosis or blood clots here. The blood will shift through this collateral circulation to supply upper extremity. Okay, so if there is any obstruction distal to the thyrocervical trunk, the blood supply will switch to fill the axillary artery. This is the importance of anastomosis around the scapula. So anastomosis around the scapula made by transverse cervical, suprascapular, circumflex scapular, coming from the axillary, artery. So this is a backup in case of obstruction. Okay. How about other branches? So we talked now about the three major branches from the first part. The second part is easy. Costocervical trunk. The costocervical trunk sends this deep cervical, anastomosing with which artery at the apex of the posterior triangle? Remember, which artery cross the apex of posterior triangle? Occipital artery. Occipital artery is going to send this branch, which you call it descending cervical, anastomosing with the deep cervical of costocervical trunk. This is costocervical trunk, and this is deep cervical branch is going to anastomose with this branch coming from occipital. Okay, and also provide some segmental branches to the spinal cord and the vertebra. The second branch go to the thoracic wall is called superior intercostal. Remember, internal thoracic supplies the front of thoracic wall, superior intercostal supply the upper part of the posterior thoracic wall. Upper part of posterior thoracic wall. Internal thoracic, the front of the thoracic wall. So this is the two branches of costocervical, deep cervical and superior intercostal. The third part sometimes gives this artery, which you call it dorsal scapular, and again dorsal scapular sometimes replaced by the deep branch of transverse cervical. Okay, so this was overview for subclavian artery and its branches. I hope that this is helpful for you. Thank you.